So one of my patients was in here yesterday. She originally came to see me for hip pain. It was back in the glute, wrapped around the front a little bit, and even down the thigh. After doing an examination, I realized that it was actually coming from the back. It was a form of sciatica. And all those symptoms were just radiating. And this happens actually all the time. People come in, they tell me they need hip therapy, and after the eval, it ends up that we treat the back the whole time because that's where the pain was coming from. Unfortunately, some people even get hip surgeries because they have hip pain, they see the surgeon, the ortho, they look, they take an x-ray, they see arthritis, they say, oh yeah, hip. Then they do the surgery, and while they're doing rehab, the pain comes back again because no one ever checked the spine. That's another story though. So this patient, it actually did end up that she did have some hip restriction, even though the majority of the pain was actually coming from the back. So we've been doing rehab, the pain, the radiating sciatic type symptoms have been getting better and better, but she still has some restriction in the hip, and we've really been digging into that now. But she has progressed to the point where she's doing more standing strengthening exercises, like lunges. So we were doing lunges yesterday, and she was asking me, man, every time I do this lunge, my back hurts, I get pressure. So if this is her bad leg, every time she goes down, she's getting pressure in her back, it really hurts her. And this is what I explained to her. In order to do a proper lunge, or any type of squatty movement where you come down, you need proper mobility in the hip. Now remember, normal mobility might look like this, but with her restriction, she can only really get back like this. And that's what we're working on. We're trying to get her back more. So the reason her back hurts is because when she goes into the lunge, she can't get all of this extension that's needed. So what happens, as she goes down, her hip gets to about here, and it says, okay, we're not moving back anymore. So you're going to have to do something else to get into the position you want. So what happens? The back arches. The back arches. And so until we get back her full hip extension, we have to modify the lunge. And so if you notice that when you do lunges or any type of strengthening movement where your leg has to extend back and you get a lot of pressure in the spine, it might be time to take a look at the hip.